Infectious bursal disease is an acute highly contagious viral disease of young chicks, having bursa of Fabricius as the primary target organ, and immunosuppression. IBD is caused by double-stranded RNA virus. The viral genome has 2 double-stranded RNA segments. 2 serotypes are present but serotype 1 is pathogenic. 5 viral proteins are present: VP1, VP2, VP3, VP4 and VP5. VP1 protein is involved in the virus replication process. VP2 is an essential immunogen of IBDV. VP3 major protein is responsible for immunosuppression. VP4 is structural protein of the virus. VP5 induced apoptosis in the infected cells by IBD virus. Chicken and turkey are natural hosts for IBD virus. Clinical disease is most common in chicken, however antibodies are present in many free-living birds. Susceptible age for birds is 3 to 6 weeks. The virus rapidly spreads through infected chicks, contaminated premises and fomites. The disease is highly contagious.
No vertical transmission of IBD is reported. Subclinical infections before 3 weeks of age lead to destruction of humoral immune response. The incubation period is very short, 2 to 3 days. Vaccination will be planned when MDA level is decreased, otherwise it will hinder proper working of vaccinal virus. Morbidity is 100%, and mortality is 20 to 30%, but it may be increased in very virulent IBD virus strains. The virus first reaches the liver, where it is detected 5 hours post-infection. It then enters the bloodstream, where it is distributed to other tissues, including the bursa. The bursal infection is followed by a second, massive, viremia. Clinical disease is observed only in birds, after 3 weeks of age, and sudden onset of disease, including depression, anorexia, ruffled feathers and drooping wings. The chalky white diarrhea, dehydration and sometimes, voiding of blood, and straining, during defecation, observed. Vent picking is usually common and may be self-inflicted. The duration of clinical disease is 1 week, and peak time for mortality is 3 to 5 days of infection, and gradually down. IBD, in white leghorn layers, is more severe than broilers. Increased clotting times, in IBDV infected chickens, suggested that such coagulopathies could contribute to the hemorrhagic lesions observed with this disease.
In acute phase, bursa is swollen and inflamed with subserosal edema and petechial to ecchymotic hemorrhages in the bursa. Caseous exudate may be present in the bursal lumen due to extensive necrosis and inflammation of bursal follicles in acute phase of disease. The swelling recedes by 5th day, and bursal atrophy is completed within 8 to 10 days post-infection. At day 3, bursa size start to increase and doubled at day 4. Its size start to decrease at day 5 and atrophies at day 9 to 10 and becomes 1/3 of normal size. At day 2 to 3, yellowish gelatinous material, a transudate, will be present in the cut surface of bursa. Other organs may also be involved, like increased mucus in the intestine. Petechial and ecchymotic hemorrhages are common on thigh muscles and pectoral muscles. Hemorrhages are also present at the junction of proventriculus and gizzard. The kidneys are swollen, and urates may be deposited in the ureters, leading to severe nephritis. Atrophic and necrotic lesions may be present in other lymphoid organs, including thymus, cecal tonsils and Peyer's patches.
All follicles are affected 3 to 4 days post-infection, and inflammation subsides. Cavities are developed in the medulla region. Necrosis and phagocytosis of plasma cells and heterophils also involved. Initial depletion of T lymphocytes in first week, followed by B lymphocytes destruction, and atrophies follicles, indicate no B cell. Transient, lymphoid necrosis, in spleen, thymus, pear patches, and Hardarian glands observed. Renal lesions are nonspecific, with acute tubular necrosis, casts of protein, and sometimes heterophils. Diagnosis and control is accompanied by biosecurity, use of immune stimulants, diuretics to avoid kidney damage, antipyretics and anti-inflammatory drugs. Thanks for watching this video. Please subscribe my channel and press bell icon to stay updated for new videos.